Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this place absolutely crazy whenever they hear me say it, I am the host of this show, your big dog, Luke Robinson. Glad to have back with us this week our co-pilot and co-host, occasionally, most nearly often, Ginger Morgan. She's the executive director of the Puppy Up Foundation. Ginger, how are you?
I'm doing great. This is the season to be thankful, and so I'm thankful for all of our listeners, our guests. I'm thankful that you and Grayson made it back from walk 3, pretty much okay. It was tough, but I'm thankful for all of our supporters.
Absolutely, and very thankful for our Fuzzybutts, for the very nature of our show, as they say. We have lots to be thankful, including our guest this week. I'm very excited about this topic. I really know very little about it, but I want to put it into practice. I know my Fuzzybutts will. JoAnne Dykhuizen, she's the owner of Feel So Good Canine Massage, here today on this episode to talk all about how to rub and rub-a-dub-dub our Fuzzybutts. JoAnne, how are you? Welcome to Fuzzybutts and Friends.
Oh, thank you so much, Ginger and Luke. It's such a pleasure to be on this show. And as Ginger mentioned, I am so thankful for the work that Puppy Up Foundation does for all our dogs and the research that they help fund, which I think is wonderful. I'm so proud to be a part of this organization.
Thank you.
Thank you very much. We very much appreciate that. We have done a lot of work towards our Fuzzybutt companions with cancer, and that's very important. But let's get to a topic that I find very interesting, because recently we just aired an episode about with the Chi University, and she was talking about all of the modalities of traditional Chinese medicine, and massage is one of those, and we really didn't have a time to drill down on that in that episode. And so I want to talk a lot about this, but let's begin, JoAnne, with how you started. How did you get into massaging our Fuzzybutts?
Okay, it all started when I was a kid, and we had collies and German shepherds, silky terriers, Yorkies, and a whole list of other dogs. But it wasn't until my husband, John, was diagnosed with multiple sclerosis, MS. And he had read an article in the paper that Labrador retrievers and golden retrievers were good companion dogs for people with disabilities. So I think you kind of all know where this is heading. So over the 4th of July, 1999, we were adopted by a 9-week-old golden retriever named Duke, and the rest is history. And so when my husband passed, and Duke was my constant companion. He helped me get through those couple of years of grief, etc. So as Duke got older, I wanted to give back to him all that he gave to me. And we all know we can never give back as much as they give to us.
Absolutely.
So I started looking into different modalities to see what I thought was interesting on the internet, and canine massage seemed like a perfect fit for me. And so what I did is I registered for a class, canine massage class, with the Chicago School of Canine Massage at the time. And it was a 6-month training class once a week, very intensive, anatomy, kinesiology, physiology. So I have to smile sometimes when people ask me if I've gone to school for canine massage, because it is a definite yes. So that's my story, and that's how I got involved with canine massage. And I've been very happy ever since taking over that endeavor 10 years ago.
It all started with a dog named Duke. I love it. I love that story. And it's interesting when we interview our guests here on Fuzzybutts and Friends. Our origin story always, I'm sure, as you know, begins with a dog of some sort, of some ilk. So it's a great story, and it's very inspiring. So how long have you had Feel So Good Canine Massage? How long have you had your business?
My business opened in 2011, but didn't really go into full full mode until after I graduated from Canine Massage School in 2013. So almost 9 years now. And it's been a little difficult because a lot of people don't understand what canine massage is and what the benefits and value of having canine massage done with their dogs.
Well, that's a good place to start, JoAnne. Let's break it down. Talk to us about massage and why do pet parents need to know the importance of canine massage?
Okay, one thing I do want to say, Luke, before we get started, is that canine massage, we do not diagnose. So if you ever feel your dog is not themselves, you really or isn't acting right, you really need to go to your vet and get a proper diagnosis for that. If after that the vet says canine massage would be a good benefit for your dog, then we would work on your dog. But we don't diagnose. And I've had so many people come up to me and say, doesn't this feel like a fatty tumor? And we just can't say it. Number one, I really don't know it. Only a vet or someone highly special in specialty field would be able to answer that question. So people think, for the most part, that massage is only good for senior dogs. That is so not true. Puppies can benefit from it, from the fact that if you've had kids, you know that as they're growing up, they grow so quickly, so their bones and their muscles are growing just as rapidly. If you've seen puppies, which I work with on a regular basis, they are restless, they're jumping around, they're happy. It all starts there. So it's really for all age group dogs. And something I learned really interesting a couple of months ago is that when you think of a human and think of arthritis, the most age group that you'll recognize would be the elderly. But arthritis starts as a young dog's disease, and it progresses if not taken care of over the years, and then you're getting full-blown arthritis when the dog's 7, 8, or 9 years old. So that massage starts at any age, and all dogs can benefit from massage.
Well, yeah, not just physically, emotionally. Well, as we know, it's all connected. From a holistic standpoint, it's all related, right? So
Right.
it seems like the massage then is most nearly always prescribed for the inflammatory process. But I got to tell you, JoAnne, I've had 5 Fuzzybutts. I have 5 Fuzzybutts, and throughout, and they've seen a ton of vets, even in their geriatric years. And I've absolutely never had a single vet once prescribe them massage therapy. So I find that, so either I've been going to the wrong vets, or veterinarians just don't know a lot about it, right? Is that
Exactly. I don't think they have very little training in it and don't really understand it as well. If you go to holistic vets, they may be more adapt to it, because a lot of holistic vets will go in, like you mentioned earlier, Chinese medicine. I'm also taking classes in acupressure, which is a traditional Chinese medicine. And it's really helpful between the canine massage and doing acupressure. It's not acupuncture. Acupressure is without the needles. And so this is really interesting. And a lot of people, I have to be honest, think that they massage their dogs. And while I think that's great that you're connecting a bond with your dogs as you're doing this, we do it more for intent purposes. So we are not just, massaging the dog and then all of a sudden we're watching TV or we're listening to music or we're doing something. When we massage dogs, we are in a quiet place where we can focus all of our attention on that. So what I've been doing over the past 5 years is doing speaking presentations, because I think it's so important that I can help educate and share my information with other pet owners so they can see how I massage and they can incorporate some of that into their own techniques that they use with their dogs at home.
I know years ago, my dog Pete was diagnosed with osteoarthritis when he was about 3.
Mhm.
And so I did some research and I got some tapes and I'm watching TV and I'm trying them out on him. And it was something, I guess, but not what you do. Okay. So just let everybody know that. But it was really funny because I would get him and he would lay down in front of me and I would massage him. And then I turned and my other dogs, like 3 or 4 of them, because I had a lot, were lined up like in line to get it was the funniest thing. Every time I did that, they're just patiently waiting their turn.
I know. Once they do it, and that, you don't get a result the first time you do it with many dogs. It depends what the issue is with the dog. And so, like most other, well, I should say with all canine massage therapists, it's kind of an individual plan that we work out with the pet owner. So it's not like we just go in and do the routine. We find out what's wrong with the dog, what the vet says, kind of develop a plan of action with the vet and even with chiropractors, and say, and kind of work as a team to decide what is the best course of action for their dog and the best way to go about that.
I like what you said, because I give massages actually in the tent at night when Grace and I were snuggles, right? I would rub him and relax him. Although he didn't do a single day of work the entire time we were on the road. He rode in a wagon the entire way. I was the one pushing him up and down the mountain. So technically he should have been giving me massages in the tent.
Exactly.
But
I was just going to say that. Did he massage you at least, like
no.
do the pushing you? At least cats will,
Yes.
need you.
I totally should have walked with the cat. Now in reflection, I should have done that.
You should have.
But
Maybe the one that's been climbing my fence.
But the important distinction, though, JoAnne, that you made, and that's important, and I want to go back to, is that it doesn't matter that I have the intent to relax him or work out his muscles or somehow work out the inflammatory process. I don't have the techniques. I don't know the areas to massage, because I'm thinking, do I do the shoulders like a person? Where do I go? So
Right.
So I would imagine I've never met a single pet parent. I would imagine that understands exactly the proper way to give a massage to their canine companion. So let's talk through that, JoAnne. So you don't have a Fuzzybutt I see there with you to demonstrate this on, but if you can, to the best of your abilities, JoAnne, talk us through, the pet parent, what is the right way? What is the right way to approach massaging your dog therapeutically?
Okay. Well, the first thing is what we usually use Swedish massage strokes on the dogs. We also use T-touch. And like we said, we can do acupressure. And so what happens is the first thing that we do before we even touch our dog is breathe. And I know it sounds really crazy, but as you're breathing, if your dog is like restless or excited or something, by you breathing, it's helping that dog to relax. And so by doing that, it's kind of saying, okay, this is kind of okay. She's not, or he's not hyper, or he's kind of like bringing it down a little bit. And so the dog starts to relax. And that's what we learned in canine massage school. We also had to, they said the most important part of massaging your dog is before you even touch them. And that's, like I said, with the breathing aspect of that. The first thing that we do is called an effleurage stroke. And what that is, and I'm so sorry I didn't bring a fake dog with me so I could demonstrate.
I'm glad you didn't, because if we had a fake Fuzzybutt on Fuzzybutts and Friends, I think people would stop listening to us or stop watching us. Yeah, they can't even get a real Fuzzybutt on that show.
Yeah, I could have brought some of the dogs that I dog walk, which are mostly golden retrievers. And I have to add this because this was really funny. When Duke passed, it seemed all my clients that year were golden retrievers. And I finally had to say, look, you've got to send me some other dogs to work on, because I need to know how they operate too. So it was kind of a funny story, just a little gift from heaven, I believe, like a God wink, they say.
Yeah.
And so the first thing is an effleurage stroke. And what that is, it's a Swedish massage. And those of you that have had human massages kind of know what this is. And it's along the same lines. The first thing is to really calm your dog down. So what you're going to do is you're going to start from the neck, and you're going to use your hands, and they all go like right next to each other. And you're going all the way down from the neck on the side of the spine, down to the tips of the paws and off. You're going to do the same thing on the other side of the dog, starting from the neck. You never want to put any pressure on that spine because there's a chance with your touch and whatever, it could be too much and it could cause some damage to those vertebrae. And so you never want to put a lot of pressure on that spine. So again, just to repeat myself, you're going on the left side, doesn't matter where you start, left or right, and you go down on the side very slowly. Slow, less is more, let me tell you that. Your dog's going to have to get used to your touch, and sometimes your touch can be very light. And in that case, if it's too light, if you're working on, say, pit bulls or any muscle-bodied dogs, by you having a light touch, that in turn will stimulate them instead of calming them. So it's always important to remember when you have a big muscle dog or even a short one, you want to be able to put a little bit of pressure, and that's going to take some time for your dog, and he'll let you know because he's going to give you one of these turns. Either I don't like that, or it's too much, or that's the way it's going to be, or I don't want you touching me. And that's why I want to back up 1 second. When canine massage therapists go into a home, I do mobiles, so I go into people's homes because I feel their dogs are much more comfortable in their own environment. But doing a meet and greet is very important because it lets me know, excuse me, whether the dog trusts me enough to touch him. If the dog does not trust me, he will or she will never have me put a hand on him or her. So that's crucial. Remember I said our work is more important before we even touch the dogs. These are some of the things that we go through. It's very important that we form a relationship with that dog. And so once that happens, then we can touch the dog by the effleurage stroke. So that is just a smooth hands-on going down the back. And then you start where the neck is and go down the paws, all the way to the paws and off again. Same thing with the right. Again, it doesn't matter which goes first. Down, slow strokes, okay? Some people will go like this, and that's kind of reacting them. If you're brushing against the fur, you're stimulating your dog. So you always have to go where the fur is laid in the direction, okay? The next one is called a petrissage. Again, a Swedish massage stroke. Of those of you, it's kind of like picking up skin and not really heavy, anything like that. It's just like picking up the skin and kind of like friction. It's kind of like, I call it itsy bitsy spiders. It's kind of like you're going up the fur and it's really relaxing them. That's the only time you should do that against the fur, is these little bitty itsy spider type things, okay? That is really good for the neck area of your dog. However, if your dog has any spine issues or anything like that, it's best to ask the vet, can we work on the neck? Because just because they have problems in the back doesn't mean that they don't in the front, especially if your dogs are having back end issues. What they're doing then, because of that, they are called what we call front loading. So they're putting all their weight from the back into the front. What do you think is going to happen? Their muscles are really tight and they need to be worked on. So it's really important. The neck is a very relaxing thing for a dog if you're doing it correctly, okay? And that's something that I'm hoping to teach. I'm hoping to have an online class starting next year where I can teach parents how to do canine massage with their own dogs. And so I'm looking forward to that as well. If people are interested in taking one step further, they can do that.
Luke,
Okay.
you need to sign up for that since Grayson is a tripod and he's missing a back leg. So you know he's going to load everything to the front.
Exactly. In fact, in canine massage school, we had a dog that had 2 legs. on the same side.
Oh.
And he was shot and just recently passed away. But again, what you were saying, Ginger, that's why I'm mentioning it. You're absolutely right. Those muscles get so tight. And if they don't get relief, a lot of canine dogs that work with the police departments, again, where are they working? They're over here. They're trying really hard. So all these muscles, their neck muscles, shoulder, everything is getting really tight. And most of us that are on computers, etc., can know that.
Yep.
They've worked in the field for a
Always.
long time. Yeah.
Always doing this and straightening up.
And they have trigger points. Dogs have trigger points just like we do. And we know that when we have trigger points released, it feels so good.
Yeah,
And
it
the
sure
same
does.
thing is for dogs as well. One thing about dogs, which I'll give you tip number 2, is their ears. Now, some dogs will not let you do this, but they will if you keep doing it like once every day or something like that. So what you're going to do is go in the dog's ear. And so you have your finger here and your thumbs behind the ear, and you're going to do little circles all the way down the ear and off the tip of the ear. Awesome relaxation technique for dogs. You can do it on both ears. You could do one at a time, depends what your dog wants you to do. But I will tell you that I could create a monster in you because your dog will probably want you to do this all the time for them. So
I can think of a couple of them that wouldn't like it because they don't like you messing with their ears, but
I bet you, Ginger, try doing that and see if after you do it a couple times, I mean, they'll shake their head or something like that. But if you get them used to it, you should have some success with it. So try it. Let me know how that works out.
Look, you try that on Indiana.
Yes,
I'll
he's had ear issues his entire life, God bless him. But why the directionality of your fingers in the massage and the circular motion? Does that have to do with how the muscles and the fibers are structured?
What it does, Luke, is it activates the nerves.
Okay.
And it regenerates everything. So it's opening up. And it's kind of like Chinese technique, is that you're doing that slow and just like rotating. And you don't have to do it fast. Again, everything is usually slow and less is better. You don't have to grab your dog's neck and pick up his skin tightly, because that's not going to work. It's going to cause more damage. And the dog is going to have a negative reaction to it and won't want to be touched anymore. So again, less is more. And if it's too, like I said, with the more muscular dogs, it's better to be a little bit more pressure than, say, a Yorkie or a Lhasa Apso type dog. So again, it depends on, and the older dogs are the same way. You want to see what their level of discomfort is and see what bothers them and what you can do to help them in those areas. I hope that answered your question.
Luke, you can try that on Lily if you would like.
Yeah, I think Lily's your kid. You work on that one. I got 2 Fuzzybutts of my own, and they already take up enough hours in my day, that's for sure, especially Grayson. But talking about Grayson, though, as sort of a use case, is that he is a 3-legged dog, and he he puts a lot of stress on his body, and so is there, when dogs that already have in the inflammatory process, when you my guess is, or I guess my question is there, do you approach therapeutically a dog differently if it's just a regular maintenance once a month massage, or you're actually treating, it's a therapeutic massage? Are there 2 different approaches or techniques that you use?
Yeah, there's 2, Luke, that I use. One is mostly like a relaxation massage, which is more or less just calming the dog, making him less, restless, that kind of thing. Therapeutic is when we're getting more into the muscles of the dog, where we have to know where everything, where all the muscles are, what they're called, that kind of thing. We need to work with the vet to say, okay, what is your best advice on this? Where should I, is there certain areas I should avoid? Is there areas that you feel should pay more attention to? I just want to mention a story of a dog, golden retriever, hard to believe, I know, was 14 and had trouble with his back end, where he would start standing, but then his back end would start to go down. We're almost into a sitting motion. So I worked on the dog for a year and worked on his back muscles as well as the front, because remember I said they could front load and that's where all their weight's going to go. And so he had a good year, and he passed away, unfortunately, in August of this year. But the owner said to me, and it breaks my heart when I hear this, but she said, "You let my dog live another year, because you massaged him twice a week for that year. He was still able to get around. Some days were probably a little bit better than others, but when I was there, he never barked at anything, but when I came in, he barked because he said, it's like, I want my massage. She's here for me. You go away."
Of course he did.
Yeah. But yeah, the therapeutic ones, Luke, is when we really get into the muscles, seeing what their pain level is. And that's why it's so important to work with a vet and a chiropractor, because they have the knowledge that we don't. It's totally out of our spectrum.
JoAnne, how would we be able to find somebody who does canine massage in different cities? Like, I'm in Memphis, so is there like do they register somewhere and I can go look up at a registry and find whether there's anybody in Memphis? Because I haven't heard of it.
Right. That I have to be honest with you, Ginger, I'm not sure. I'm sure if you put in canine massage therapist and in Memphis and see what you come up with, and I would kind of interview them to see which one might work best for you, or you could ask your vets if they're aware of massage therapists. Several of them will refer out. So I don't think there's a registry, but I could be totally wrong.
Yeah, that was my question. It doesn't seem like there's a national directory, though. Although, Ginger, we should check out the Chi University, though, because they have a national directory on traditional Chinese veterinarians.
Yeah,
and it was such a powerful a podcast that we had that inspired me to, in addition to my traditional veterinarians for my Fuzzybutts, also go and take them to see a traditional a Chinese veterinarian, medicine veterinarian, or I think I screwed that up. Anyway, because we all know, although in a discussion with her, I don't understand why it's an either or, why we don't have this more complete, holistic, let's combine both the Eastern techniques and what we know diagnostically and therapeutically. What we've done so well here is to develop tremendous diagnostic tools and therapeutic tools as well for canine companions. But there's this other benefit, tremendous benefit, and we can't necessarily scientifically quantify it right now, but we know it shows demonstrable results. And back to Grayson, he's only 2 years old and he has hip dysplasia already.
Oh my gosh.
Yeah, and oh my gosh, we just had a serious episode. We'd only been back from walk 3 a couple of days, and he was unable to walk on his hind leg completely, wouldn't even move. And if I touched anywhere in that area, his hind area, he whined and yelped. He was almost completely immobile. And so
let me interject just half a second that Grayson was not walking on walk 3. He was in a cart. Just so everybody knows that walk 3 is not what caused Grayson's having this issue.
Yeah, I think I already said that, but yeah, that's important. It's like, I was like, what's wrong with you? Why are you not able to walk? You didn't do any walking. I was going to get to that, Ginger. You kind of ruined my setup. You ruined my setup there. But it's like I just had no idea what's wrong with you. I mean, my mind immediately goes to bone cancer because we know bone cancer occurs in young dogs too. But I'm like, why are you, why are you having problems? Why do you have hip dysplasia? Because he rode the entire way, which actually I think had the opposite effect, is he didn't get a lot of exercise. And my guess is there's some atrophy there. So now I have to restart the process. But Grayson sees a good physical therapist here in Memphis when we're here in town, and so he goes through he's been going through therapy, and they do the ultrasound on his nub, where the inflammatory process, where he has he's prone to have an inflammation as well. And I'm assuming, Ginger, I can't recall, they ultrasound the hip area too as well. So we need to look in that. So we know
They did an X-ray on it. I don't think they did an ultrasound, but or maybe when he had that stomach issue is when she found out that he had hip dysplasia. So maybe she did do an ultrasound and then saw the hip, or it was a stomach X-ray and saw the hip. I'm not sure.
So ultrasound uses vibratory techniques, and we know that it has some therapeutic benefit as well. So how do you communicate that to pet parents? How do we get that message out there? Because as what we were just talking about is that I've never had a veterinarian once say, hey, you have a dog, a geriatric dog, or even a middle-aged dog, or a three-legged dog. Hey, there's going to be some tremendous inflammation that your dog is carrying on his hips. You need to get it checked out. So that's a big problem. So what are you doing in the areas of educating veterinarians, and how do you interface? Are all your clients referrals?
Yes.
Wow.
Several of my referrals, others I meet just in passing or at pet events, pet expos, that kind of thing. But I really realized, and I don't mean this negatively, but a lot of people never heard of it before, number one. So educating people is my top priority. It is my top niche, even over canine massage, because I think it's so important. It breaks my heart when I see that people don't know what they can do for their animals, for their dogs. And it breaks my heart all the time when I see it and they're like, I didn't know about it. I didn't know it existed. And it's been around, believe it or not, for 30 years. And it was like 20 years when I went to massage school. So it's been almost 10 years. So 30 years it's been out there, but only recently is it starting to become aware. And that's by people talking about it, explaining what benefit is. Canine massage should be just as important as feeding your dog, giving them water, checking things out. I'm taking a class called Canine Arthritis Management. What a shocker that is. And it's like, people think that when their dogs get older, maybe 8, 9, 10, they have trouble walking. And they think, well, he's lived a good life, she's lived a good life. And they don't do anything. But they probably don't know they can. And the problem is that more than likely, your dog's in pain. 60% of dogs 8 years and over hide their pain. Dogs 7 and younger, 20% hide their pain. And that goes back to when it was a wild pack. If a dog or a wolf was like injured or didn't fit in the pack, they would be left behind, that kind of thing. And a lot of times too, you'll even notice at end of life issues, dogs will not show their pain that much because we're not ready for them. And I do several palliative end of life stages with dogs, even if it's gentle massage, because the owners don't know what to do and they want to do so much for their dog. And so these options are so important. And that's why I want to tell everyone I know about canine massage, because people think it's a lot of money. It really is not. And Luke, you said that Grayson has physical therapy. Canine massage can work in between physical therapy appointments. It's just, work with the therapist, see what can be done. and then talk to a reputable canine massage therapist. So I'm kind of biased because I think they're all good, but it's good to understand and feel comfortable with whoever you have as a therapist. A lot of the rehabs do have canine massage therapists, Ginger, in their plan.
I'll check. I know I have a massage therapist, and he came. I think he's kind of dabbled in canine massage. And I had a dachshund that, they all have back issues sooner or later. And he came over to the house and massaged her, and she was so cute because she was just like, oh, you are the man,
I know when I first started out with canine massage, I had massaged, I won't tell you what breed because we all know which breed that was. And so
hey, it sounds like you only treat golden retrievers. And last time I checked, that breaks some statutory laws in the dog world that you can't discriminate based on
I'm
breed.
trying not to, but I just have to tell you what as it is. But anyway, I thought I killed it because it went into such a deep sleep.
Oh, that's so funny.
I mean, you can't really kill it with canine massage unless you're really rough with the dog, but I gave him a relaxation massage. And I'm sitting there going, oh my God, I couldn't even see him, like his chest moving or anything. And then when I got up, he got up, and I was like so relieved. And I'm like, well, this definitely worked for him. So,
again, I am no canine massage therapist, but I went to a friend's house, and his dog had arthritis. And so I just remembered what I had done with Pete. And it was really cute because he was standing up, and I was just rubbing like in little circles and stuff all around his hip. And the guy said, I've never seen him stand so still before. And then the dog turned around for me to get the other side. And he was like, oh my gosh. I was like, yeah, well, it's just, Mommy G has the touch, I guess.
I know it's such I have to tell you this one story if we still have time. Coming out of school, we had to do 5 case studies, and they were like once a week, 5 times a week, for 5 weeks. And I got a dog that was a puppy mill dog. I'm not saying what breed it is. So anyway, if you went up to the dog, he would cower, and he was a puppy mill dog, so he was not even 6 months old. And that dog wanted nothing to do with me. And so I would throw treats out to see if he would get a little bit closer to me. That wasn't happening. And didn't want anything, terrified of kids. And so the 3rd week, I brought my dog Patches with me, and we sat in the living room, and all of a sudden the other dog got kind of interested. Patches, by the way, was the Shih Tzu Papillon. So he was my father's dog. So he's not a golden. So he was a Papillon, the cutest dog ever. And so the other dog started coming a little bit closer. And by the 5th week, I had my hand around the dog. He had a ball in his mouth, and all was well. And I still see this dog. And every time I come into that home, I cannot get a rest until I massage him first. So, I mean, these are great stories, but it's all, what I really want to stress to people is to really, it doesn't matter how old your dog is now, whether they're a puppy, adolescent, middle-aged, old age, it's never too late to start with your dog. Never. Because if you can give them some relief from their discomfort, that is amazing. You would make me very happy by doing that, because I'm out there ready to help parents whenever they have questions. If again, we can't diagnose, but it's just, I love helping pet owners and their dogs. It's a great, fulfilling job that I have, the best job in the world.
Yeah, well, the value proposition clearly is there for pet parents. Not only that it benefits some dogs, their canine companion emotionally, it strengthens the bond between the pet parent and their companion. It extends quality of life for senior dogs that are in intractable pain, and then it has therapeutic benefit as well.
Mhm.
So going back to Western medicine, the PT here in Memphis, they do not. They'll do the ultrasound, they'll do everything except the massage. I've been doing this long enough, especially as it pertains to veterinary oncology, to
Mhm.
know traditional or Western, I shouldn't even use the word traditional, Western practicing veterinarians, they don't prescribe any treatment or diagnostic techniques unless there are studies that prove some degree of benefit downstream, for whatever reason, any number of reasons. I'm assuming it's a liability thing. So my question to you then is how do we, so are there any studies right now currently, do we have any studies about how massage, canine massage, could potentially benefit or extend the life? Are there any studies out there at all that you know?
I have to be honest, Luke, I don't know. But I will certainly find out now that you brought that up, because I'd like to know that myself. But I do want to backtrack because I think I did not answer one of your questions. When you were talking about how do we educate the vets, the best way that we're trying to do it is what we call lunch and learns, where we'll go and we'll say, okay, we'll pay for lunch if you listen to me for 20, 30 minutes. Because again, it's not that the vets don't want to recommend us. I really think that they have very little education on it. And I don't mean this in a negative way. Their lives are so busy right now with everything. It's hard to, I think, to put one more thing on the plate. And getting the treatments for the dogs that really need it is the most important. But doing lunch and learns and asking them, okay, I want to do this. Do you have time to shut down for half an hour, which most do? And let me tell you what I do, and tell me if you think it's reputable to refer me. And so we have to build that rapport with the vets. We also have to let them know we're not here to take over anything, because again, I've had vets in my presentations that I didn't know were vets at the time. And I must have said at least 10 times, if there's something wrong with your dog, you need to go to your vet. And it's totally out of our scope of practice. And I would feel bad if I ever said something to someone like, oh yeah, it's probably just a fatty tumor and turns into be cancer. One thing I do want to tell you is, if we still have time, I want to tell the pet parents there's 5 things on a dog you should never massage.
Sure, go ahead. I want to hear this.
I know you do. Bring it up.
I can guess 1 or 2 of those things.
One of them is, if you look at here, like a V, okay, the dog's vagus nerve is in their ear, okay? Our vagus nerve is behind our ears. There's a little indentation there. Okay, right here is their vagus nerve, all their arteries and nerves and stuff like that. I see people going in like this, like really cranking it in there. What you're doing, you can do this, which we are calling to palpate, which is a soft touch, but you never want to go in there and really crank it in there. What that's doing, it's affecting your heart, their digestive system, and everything else. And you can see, people look at me when I say, you need to look in your dog's eyes, because they can tell you a lot just in their eyes alone. And so you can see some of them are very distressed. It puts them in a fight or flight, if you have any kind of psychology background, but it puts them in a fight or flight situation, okay? That's one. You don't want to put anything, you don't want to do this in here, because of the fact there are nerve endings there. And what it does, it can make your dog numb, and his gait may be totally off because you're affecting, they're called the brachial plexus nerves. And
So
on either side.
I don't mean to interrupt you, but for those people who are listening, you were touching it like on your armpit, but it would be the same thing for the dog, in the dog's armpit. You don't want to grab and rub in there. Okay.
Yeah. Third place is the spine, which I already mentioned before. Fourth place on a dog's back legs, where the leg meets the trunk of the dog. That is also like right as that there's an indentation there.
Yeah.
That's where you also can figure out your dog's pulse. For those of you that don't know where it's at, that's where it's at. But if you press it too hard, it's going to spike their temperature.
And that's on the inside of their leg, correct?
Exactly.
Okay.
Okay. The last part is behind their legs. Behind their knees. I'm sorry, behind their legs. Behind their knees. And what that is called the popliteal fossa. And that is also has a lot of nerve endings and arteries there. So like if someone kicked you in the back of your knee, that would hurt, wouldn't it? The same thing for the dog. It tickles the dog and it affects their walking and running. So you never want to apply a lot of pressure, especially where all these nerve endings are. So I hope you take that into consideration when you're massaging your own dogs.
No, that's very important. I would imagine I've personally I've only had a number of massages. It's never really been my thing, even though I've certainly run roughed my body over the years. But I once had one of those deep tissue massages, and I remember afterwards it was just so excruciating. It was such a traumatic event because every part of me hurt, and then I tried to get up and I almost fainted. And it really released a lot of things in my system, and it took a while for me to adapt. And I was wondered, did they hit like a wrong nerve area or something like that? So yeah, knowing those 5 areas, what the areas you can't massage are very important for pet parents for sure.
Hey, Luke, I wanted to clarify something earlier. When you were talking about how the PT here in town used ultrasound and some other stuff, did you actually mean laser therapy?
Yeah, but that laser therapy is ultrasound, is it not? No, that's right.
No,
That's what I meant. I meant laser. I was getting it confused with the
yeah. So when you had said that earlier about
I'm still recovering from walk 3. It's been
when you mentioned ultrasound the first time, and I was confused, and I said something. You looked at me really funny, and then when you said it again, I thought that you actually meant laser therapy. So just
yes.
Thank you. Use ultrasound as a therapy.
This is precisely why you do not want me massaging my fuzzy butt. And I think that's an important issue, though, JoAnne. I think that's very important. Is that I want to be able to do it, but I also want to do it correctly to a certain extent. But I don't think that should supplant or replace having a certified canine massage therapist to do it, because you, like as you said, you spend a lot of time in your erudition and learning. 6 months, I think, is what you said, and all the additional courses and additional learning modules you take, and that's a lot of time. That's a huge investment, that a pet parent has to take. And I just think, even if you spend all that time to master it, I kind of like the idea of, I want to be able to learn how to do the techniques, and I want to learn that I do, and try them, and then do it in a non-professional way, more of just like spending time with Grayson and our time together. But I find it very, very important and I'm going to be looking for a canine massage therapist here in the Memphis area, because the PT where I take them, they don't offer the services. So how often, on that note, I'm imagining you recommend to pet parents that they, in addition to what they do with their pets, that they come in. How often do they come in to see you, I guess, is where I'm going.
It depends what the issue is, Luke.
Okay.
If it's a arthritis issue, if it's a hip dysplasia issue, if there's other issues going on, then we spend more time, obviously. If it's just a relaxation, it could be a one-time thing. I do give parents some little tips while I'm there, so they know what to do in between visits. Like we say, why don't you try this? Why don't you try that? A lot of the things too is, if you don't have a canine massage therapist, just placing your hands, because our hands are really warm. And if you kind of like rub them together and put on your dog, like their back end or something, that really warms the muscles too, believe it or not, because you're putting that warmth, because you never want to do a canine massage if your dog just came out of the cold, because what's that going to do? Their muscles are still tight. And so what you want to do is you want to warm up those muscles. And by doing that, we do it a certain way so the muscles are released and kind of, you can feel them spreading, and then you can do your therapeutic massage. But you never want to do a massage when, number one, when you're preoccupied with everything else. Even though you're spending time with your dog, I think that's awesome. But if you're looking for things, and this is my most important thing in educating parents, is the fact that when you get used to touching your dog and looking for things, like say if you're paying really attention and you're petting your dog and you're thinking, wait, this lump came here that wasn't there last week, you're going to start noticing things and changes in your dog's body by saying, this wasn't here last week, or I need to know, what's going on here. So wouldn't you rather have it taken care of now than have it escalate to a point where a lot of people, it costs a lot of money to take care of their dogs?
Yeah, that was going to be, I'm sorry, go ahead.
No, that's okay. I'm not trying to get out of paying vet expenses. It's just, isn't it better now to take care of something?
That's exactly what I was going to say, is that seems to be really your better, bigger value proposition to veterinarians for referrals than anything else, is you're an early screening, is that you have your hands on their patients, probably more frequently than the veterinarian does, which is typically once a year unless there's a problem of some sort. So one of the things that we say, and Ginger talks about a lot here on Fuzzybutts and Studios, is always be checking your canine companion, your Fuzzybutt, for lumps and bumps. And that's a hands-on thing. So having hands-on your Fuzzybutts is something you need to be doing always periodically, whether it's weekly or bi-weekly, or at a minimum, I would imagine monthly. So that you have the ability to identify a lump or a bump is a tremendous value add, and then that becomes the referral then to the veterinarian.
Well, it was funny. I had a dog that I just had seen, and the dog had, I am not exaggerating, had a lump on his neck the size of like a baseball. And I was so, it's like I can't, they're not my dog, so I cannot say anything, but I was just kind of surprised that the dog this was never taken care of. Like, how long has the dog been having that? I also ran into a person when I first started out of canine massage school, and he came up to my table and he said, could canine massage help my dog? Because my dog got hit by a car. Well, I'm like, oh my God, yes, and whatever. I said, well, what did the vet say? Well, I didn't take him to the vet. And I said, how long ago did this happen? 3 years ago. So that's what makes me sad. That breaks my heart when I see these kind of situations that can be helped. So it's just really sad that you hear these stories, but there's so many good stories that come from what I do as well. And those are what make you go on every day. And they're funny stories. They're fun and they make you happy, and the parents are happy, pet parents are happy. And it's just, when you were saying about Thanksgiving, there's just so much I'm thankful for because I get to do a job I love. So.
Yeah. So JoAnne, how many times have you found a lump or a bump and you've asked the pet parent, do you know about this? Do you know, or this is a new lump or bump since I saw your dog last, and they may not have even known about it?
They didn't. I would say half my clients.
Oh, wow.
I would say, has this been here before? Or I felt something, and they've taken immediate action to go into. What I'm trying to do is get parents to take a more proactive. I'm not asking them to spend a lot of money, but I'm asking them to get it checked.
Right.
And so if you want your dog to have a longer and healthier life, why not do it now? Then wait till it escalates.
One of the things that I think that's important for pet parents, whether they're massaging their dog or not, but we pet our dogs, and typically you pet them on the top of their head, you'll rub behind their ears or their ears or down their back, but they seldom feel all over the dog. And I do that. I try to do that periodically all over. And I know I took Lily, who I referred to earlier, to the vet a couple of years ago to just have some things checked out. And I was like, well, and her left shoulder feels really hot to me. And the vet's like, oh, I don't feel anything. I said, well, I really need to have that checked out because, we deal with canine cancer and it's, anyway. So, and then the vet was like, well, I didn't feel anything. Do you still want me to x-ray it? I'm like, oh yeah, I want an x-ray of it, because at least maybe she sprained something or whatever, but it could have been something very much more serious than just a sprain, or she inflamed it by doing, who knows what Lily does in her off time.
Well, Ginger, that's an excellent point, because that was going to be my next advice too, is that you want to feel your dog too if it's hot, because that could be a signal of an injury or inflammation. So you kind of want to do it. And even though, you realize it and you did the right thing, the vet said, I'm not feeling anything, but I still want the x-ray done. It's important to do that. It's just really important to get to know your dog's body.
Yeah.
And say, wait, this is hot, this is warm here. I mean, not naturally when they're outside and it's 95 degrees, it doesn't matter.
If you're in Memphis, it's hot. You have to wait till they cool down. A funny story. I do some pet sitting as well. And I went over to meet these people's dogs, and the dog was a Great Pyrenees mix, really cute. And I was rubbing on him, like from the neck down, just real calm. And I stopped at his shoulder and I did it again. And the people they gave me instructions and all this stuff. And I said, do you realize your dog's, left shoulder is inflamed? I'm like, oh, they both looked at each other. First off, they went, how did you know that? And I'm like, well, it's warm. And I said, well, the vet said he was okay. And I was like, he's not, it's still inflamed. I said, you need to maybe call them and get, something else to help him, and another anti-inflammatory something, because he still hurts. And just the look on their faces, it was priceless. And my friend was with me and she looked like, only you. I'm like, it was kind of like, I felt like I almost scared them off by being, what do you call it? A psychic or something,
Well, Luke, I have to tell you that I have worked on Great Pyrenees.
Well, that's good to hear. Good, because I was worried about that. Well,
I think that pair was a pair golden retriever mix. So just let's get the golden in there.
Well, that's what I was going to ask next, is where are you based out of? Because I would love to come bring one of my, or maybe both of my Fuzzybutts to come see you. Where are you based out of?
Oh, I'm outside of Tinley Park, Illinois, and outside of Chicago. We actually met you both several years ago when you were up here visiting. And then, but what's nice is with Zoom now, I can work with owners all over the country where they can set up a Zoom call with me and I can do a free consultation or give them some advice. I don't give them advice, I don't diagnose, but I think the listeners know what I'm saying. I kind of can do that, and that's why I like doing this online class. I'm trying to get this organized for February or early March, where I can actually teach it Zoom, where people can have their dogs right there when I'm teaching the class, and they can actually do the techniques and procedures right there with their dogs and ask any questions they may have while doing that.
Yeah, that's exactly where I was going next, is that we can't come to see you. How can we actually see you without physically getting there? It's almost like I'm not needed here for this show. You guys are just going through checking down the list right there without me.
Well, you can always take Grayson in Indiana to see JoAnne when she does her puppy up walk next year.
Yes.
Puppy up
I'm on the
Chicago. Chicago's a tough nut to crack. That's a big city. We try
Well,
to
she's
become.
outside of Chicago, so maybe it'll be a little easier.
Well, we would love to come
Yeah.
see you anyway because I try to I'm a best practices kind of person, and I want to see it. It'd be great to do it in Zoom, but I want to see it in person for sure and walk through it, because that's really what we've learned here, everyone, today, is that there are just tremendous benefits from early screening, early diagnostic to therapeutic benefits of canine massage. So if you can't find a practitioner in your area of canine massage, then you have resources out there. So JoAnne, how do people find you, find your website? How can people sign up for one of these Zoom classes that you offer?
I'm on Facebook, and it's under Feel So Good, the letter K, the number 9.com. Feel So Good Canine Massage. And then my phone number is 815-341-0919.
It's kind of
they
fun.
can reach me.
And until you mentioned the Papillon and the Great Pyrenees, I was going to say you should really, the name of your organization is Feel So Good Canine Massage, only for golden retrievers. That's the real name of the organization.
So unfair. So unfair.
I love golden retrievers. In fact, actually, I am a Pyrenees guy, but I love all of our Fuzzybutts. I really do. But the interesting thing is, if you put a golden retriever puppy next to a Pyrenees puppy, they pretty much look almost exactly alike. And they have very, very similar temperaments. So I get it. I love Goldens, and unfortunately, they're one of the number one cancer
Number one,
out
yeah.
there. So I
Well,
bet
they
you see a
said-
lot of them as patients.
Well, it's good with the Great Pyrenees because you can sit on a couch and massage.
Exactly. Yeah. Yeah, that's what you're going to want. You know, as we all get older, we want bigger dogs so that we don't have to get in the floor.
I'll tell you what, Ginger and Luke, I'll make a trip down to Memphis sometime, and then I can massage your dogs and teach you all you need to know.
And you
Perfect.
can also teach Grayson how to massage Poppy, because we're going to go backpacking again. And I need to give him that massage. I need that therapeutic release in the cold, dark nights in the tent where my muscles are just on fire. I'm all inflamed. Well, this has been
good luck with that.
This has been such an informative episode. Really is quite wonderful. It's got me excited. I've already, with our last episode, I've already made it my mission to find a traditional Chinese veterinarian as nearest to possible and start doing that. And I will incorporate canine massage into our annual. It's basically our annual plan with my Fuzzybutts. But we would love to have you down, or I know Ginger would love to have you down here in Memphis, because we do a puppy up walk down here as well. And if if you come here for a puppy up walk, it might be, Ginger, this is a really good idea. Is maybe, I don't know if you do you have the dog tables out there, like the massage tables where you stick your head in the hole? Do they have those for dogs where they stick their stuff in there?
No, we use a massage table, a regular human massage table, believe it or not. But
Why
most of the dogs like to be on the ground.
Oh, I was going to say, why don't we set up one of those tables there at the puppy up walk, and you could just have them line up, just line up for a massage.
You got it.
Great canine massage. That's awesome.
Give me the date and I'll be there.
Well, JoAnne, you've met Lily, so I think she's not going to tolerate any type of massage. She barely even wants me to touch her, and she's 15. I've had her since she was 12 weeks old. So,
yeah, my apologies for not remembering you, JoAnne, that we've met in person. I've met thousands and thousands of people on my travels, and my memory as I get older, my brain is inflamed. You
don't remember meeting me, Luke? That's
yeah. If that really was Chicago, was that?
It was. We had the walk inside the mall.
Yeah, that was many years ago, back when Hudson.
No, it wasn't. It was 2 years ago.
It was 19, wasn't it? It was 19. Yeah, it was 19.
Well, that I don't even remember that. Should just be.
Oh my gosh, Luke, don't you remember?
His brain is inflamed.
Oh man, don't you remember it was inside the mall and Hudson decided to pee right inside the mall?
I remember that.
Did he do his business? Did he pee or?
I think he pooped.
Oh, of course he did.
But yeah, he was such a character.
Ginger was just being polite.
Well, he was splayed out there in his Santa outfit, right in the middle of the mall. He was such a character.
And Lily had on her Santa, Mrs. Santa outfit, and Hudson had on his Santa Claus.
Yes.
Well, it's about that time of the year, though, coming to the holidays. So maybe that's what our pet parents, our audience out there is give your canine companion, your fuzzy butt, a massage this Christmas. That sounds like a wonderful Christmas gift, doesn't it, JoAnne?
Yep, I think it's a awesome idea.
There you go.
Yeah. All right, JoAnne, is there anything else that you'd like to? So you're on Facebook. Are you on any other social media? Do you have a website?
I do.
Okay, what's the website?
Yeah, it's www.feelsogood and then the letter K, number 9 massage.
Okay, so it's all Feel So Good Canine Massage pretty much everywhere, Facebook.
Yeah.
Okay, that sounds great. All right, JoAnne, did I leave anything else out, or is there anything else that you would like to cover that you can think of?
Well, if your listeners have another 5 hours, I have plenty.
I bet, but I love that about you, JoAnne. You're so passionate about this, and you're always learning. You're always on this path of continued erudition to expand your abilities to help our fuzzy butts. And I love that about you. I think that's so important. And even though we have a limited amount of time on this episode, you're a true friend to our fuzzy butts, all of our fuzzy butts around the world. And you're welcome back on Fuzzy Butts and Friends at any time to talk more about the topic. But next time, let's get a real fuzzy butt, not a fake fuzzy butt, because I'm not getting canceled because of a fake fuzzy butt.
we can do it when I come down to Memphis.
There you go.
Right.
How's that?
That sounds great. That sounds great. All right, Ginger, we're at that time of this episode where I have to ask you, did I screw anything up? Did I leave anything else out that you can think of? And do you have a cancer tip for us this week?
Well, I think a lot of the show has been a cancer tip about when you're massaging your dogs to feel for those lumps and bumps. And then if there's anything new that you haven't felt before, or your veterinarian has not checked out, then take them to the vet to get checked out. Because as JoAnne said earlier, nobody can tell you whether what you're feeling is, if it's something, just a fatty tumor, or whether it's cancer. You really need to go to the vet and get a fine needle aspirate to be able to have that diagnosed properly.
I think that's just the overall tip for this episode is hands-on fuzzy butts, because you can tell so much, you can learn so much, because as we know, dogs can communicate to us, most importantly and critically when they're in pain, because nature made them that way. And so the only way that you're going to have any sense of early screening for any number of troubles is hands-on fuzzy butts. I kind of like that, hands-on fuzzy butts. I like that phrase. Maybe trademark it and sell on shirts or something. All right, guys, I think that's it for this episode of Fuzzy Butts. I'd like to thank again Dr. JoAnne Dykhuizen with Feel So Good Canine Massage outside of Chicago, or you can go to her website and potentially get a Zoom meeting there. I highly recommend it. Actually, get a canine massage for your kid this Christmas. I love that. So, Will, thanks so much for tuning in this episode. I'm back in Fuzzy Butt Studios, so we'll have a brand new episode that comes out every Tuesday. You can find us on the podcast channels on iHeartRadio and Spotify, or if you want to watch the video of this, you can find that on our YouTube channel, and that is fuzzybuttstudios.com. Until next time, puppy up. Talk soon. Thank you, guys.
Thank you.
Thank you.
I always forget to thank everybody before I sign off. I'm sorry. Bye-bye, everybody.